What is the Acute Leukemia Shared Care Program for acute lymphoblastic leukemia? In this video, you will learn: what is the Acute Leukemia Shared Care Program? What is the treatment process for acute lymphoblastic leukemia? How your cancer care may be shared between cancer centers.
The Acute Leukemia Shared Care Program is for patients with leukemia who live far away from the Princess Margaret Cancer Center. Shared care means your cancer care is shared between the Princess Margaret and a partner cancer center. With shared care, you get the same high quality of care without the expense and time of having to travel to downtown Toronto. At this time, there are 3 cancer centers in these regions that work with Princess Margaret to provide shared care. These are Aurora and Newmarket area, Stronach Regional Cancer Center; Barrie and Muskoka area, Hudson Regional Cancer Program; Oshawa, Ajax, and Pickering area, RS McLaughlin Durham Regional Cancer Center. Shared care may be an option for you if you live within these areas. In the future, it may be possible that Princess Margaret partners with other centers to provide shared care. What is the treatment process for acute lymphoblastic leukemia? To understand how shared care works, it is helpful to know what the treatment plan for acute lymphoblastic leukemia is. Acute lymphoblastic leukemia, or ALL for short, is a type of blood cancer. There are many different subtypes of ALL. These subtypes may have slightly different treatment plans. This video gives you a general overview of an ALL treatment plan. Treatment for ALL is a long process and can take between 2 to 3 years in total. The first treatment is induction chemotherapy. You will stay overnight at the Princess Margaret for 4 to 6 weeks when you get this treatment. The aim of induction chemotherapy is to put the leukemia into remission. Remission means that leukemia cells can no longer be seen in your bone marrow, and your bone marrow starts to produce normal blood cells. If your leukemia is not in remission, talk to your oncologist, also called your cancer doctor, about next steps. If your leukemia is in remission after induction chemotherapy, the next treatment is CNS chemotherapy. CNS stands for Central Nervous System. The central nervous system includes the brain and the spinal cord. Leukemia cells can sometimes enter the fluid that surrounds the brain and spinal cord. This treatment phase helps prevent the spread of leukemia cells to these areas. You will get the CNS phase of treatment at the Princess Margaret over 3 weeks. You do not need to stay in hospital. For your CNS treatment, you will get IV chemotherapy on day 1 of this phase. After your IV chemotherapy, you will take oral chemotherapy for 2 weeks. You will get chemotherapy injected into your spinal fluid once or twice a week, depending on your treatment plan. Once your CNS phase is completed, the next part of treatment is the intensification phase. The aim of intensification chemotherapy is to kill any leukemia cells that may remain after induction chemotherapy. You will get intensification chemotherapy every 3 weeks for 7 months. Like the CNS phase, you will get your chemotherapy at the Princess Margaret, but you do not need to stay in hospital. The next phase is maintenance chemotherapy. The aim of maintenance chemotherapy is to keep the leukemia from returning, also called relapsing. You will get maintenance chemotherapy every 3 weeks for 2 years. Shared care may be an option during the intensification and maintenance phases of treatment. How will your cancer care be shared between cancer centers? Before you start the intensification and maintenance phases of treatment, your oncologist may discuss shared care with you. During the intensification phase, you may be able to get your non-treatment appointments at a partner cancer center. These appointments can include blood work, other medical treatments if needed, for example, imaging, blood transfusions, hydration to replace fluids in the body, treatment for problems caused by low white blood cell counts, and central line care, for example, care for a PICC line. During the maintenance phase, you may be able to have your chemotherapy at a partner cancer center. You may have all your non-treatment appointments at the partner center as well. Your oncologist will discuss what appointments you can have at your partner center based on your care needs. Care needs can include, for example, how mobile you are or how complex your cancer is. Once you finish the maintenance phase, you will continue to get follow-up care. Follow-up care can be at Princess Margaret or your partner cancer center. Where you will get your follow-up care will depend on what you and your oncologist decide. For more information about shared care, talk to your oncologist.